UTIs. I'm pretty sure you guys are all familiar with this topic, UTI. So what is UTI? UTI is a urinary tract infection, and women are more susceptible to get UTIs because they have shorter urethra, and it's easier for the bacteria to travel up to the bladder because they have short urethra, right? So what are the signs and symptoms? Signs and symptoms are urgency. When they have to go, go, like they can't wait. Frequency, they want it to like stay in the bathroom all the time. Burning pee, and flank pain, back pain, suprapubic pain, and blood in urine, all that kind of symptoms. And if you think you are having this all symptoms, then it is very important to get it evaluated and go see your doctor, because when you go see the doctor, they will run like a urine analysis, and they will send that urine for the culture too. So on the urine analysis, what your doctor is looking as for bacteria growth is there, like if the urine is positive for bacteria, right? And WBCs, any blood in urine, nitrites, and all that. And after they get result on urine analysis, and your provider can send that urine for the culture. And for culture, it will take about like 2 to 3 days to get it resulted to grow that bacteria, right? So while we're waiting for that culture to get resulted, which takes about 2 to 3 days, right? So what we can do is we can still get you an antibiotic and treat your symptoms while we're waiting on that culture result. So we'll give you an antibiotic that will cover for the usual bacteria that grows in the UTI, which is E. coli. But if your urine culture happens to grow different kind of bacteria, then yeah, we'll give you a call and we'll change the antibiotic that covers for that bacteria, right? Yeah, and the treatment for UTI, it depends on the allergies. Like if you have any allergies to sulfa, then we'll give you antibiotics that doesn't have like any sulfa. Pregnancy status, and definitely symptoms, like if you're having flank pain, back pain, and if you have like systemic symptoms like fever, chills, body aches, nausea, vomiting, then we probably have to send you to the emergency department to get IV antibiotics, because it is complicated at that time, right? Might be pyelonephritis, and they need like a certain antibiotic which we can like give you PO. Yeah, usually the antibiotic will be microvit, nitrofurantoin. That's the first line drugs for the UTI, like for uncomplicated UTI. And then Bactrim, Keflex. I like Keflex because like to prescribe it for the older people, because it's not very harsh for the kidney. So yeah, and the prevention is very important as well, because people will get like recurrent multiple UTIs over a year. Like I have seen a patient who gets UTIs every 2 weeks. So prevention is very important. So what we can do is hydration, right? And personal hygiene. So when you're wiping, wipe from front to back, not from back to front, because we don't want the bacteria in your back to come over the front. And avoid any tight underwear, undergarments, panties, and yeah, so you probably have heard about the cranberry supplements, right? So yeah, data shows that cranberry supplements has that compound which will prevent the bacteria to stick in the bladder. So it's not good for like if you have active urinary tract infection, but it is very helpful to prevent getting the UTIs, recurring UTIs. So yeah, cranberry supplements is a good supplement, and I have heard people have like good results with the probiotic too. So yeah, you can try that out. UTIs are very common, right? So get it evaluated, get it checked, treat your symptoms, like to prevent any serious complication in the future. So yeah, stay hydrated, maintain your personal hygiene, don't wear any tight clothes, and then avoid holding your pee for a long time. Yeah, those are my 4 important ones for the UTIs. I hope you like this video. Thank you. Bye bye.